Obsessive-Compulsive Disorder, OCD, Unveiling the Intricacies. Obsessive-Compulsive Disorder, OCD, is a mental health condition characterized by intrusive, distressing thoughts, obsessions, and the compelling urge to perform repetitive behaviors, compulsions. Neuroscientists posit that alterations in brain pathways associated with judgment, planning, and body movement contribute to the manifestation of OCD symptoms. Moreover, environmental factors such as familial relationships and stressful events can act as triggers or exacerbate the symptoms of OCD. This disorder impacts up to 3% of the global population, with a childhood onset variant more prevalent in boys around the age of 10. The majority of individuals with OCD experience their initial symptoms before the age of 25, with women outnumbering men in this group. There is compelling evidence supporting the genetic basis of OCD, particularly in cases with an onset during childhood. Symptoms. The hallmark symptoms of OCD encompass obsessive thoughts and compulsive actions that significantly disrupt daily life. Obsessions are persistent and distressing thoughts that invade one's consciousness and can center around various fears. Common obsessions include a fear of contamination, concerns about accidents or violence, apprehensions related to committing acts of violence or sexual misconduct, and anxiety centered on disorder or asymmetry. While adults with OCD may recognize the unrealistic nature of their obsessive thoughts, they often attempt to alleviate the distress by engaging in compulsive actions. Compulsions are repetitive behaviors or mental acts performed with the goal of reducing the anxiety associated with obsessive thoughts. Examples of compulsions include excessive washing or bathing, avoidance of handshakes or doorknobs, frequent checking of locks or stoves, counting objects compulsively, over-organizing work or household items, adhering to specific eating orders, and repeating words or prayers. The excessive and distressing nature of these obsessions and compulsions, which can consume several hours daily, may lead to physical injuries, such as chapped hands from compulsive washing or bleeding gums from excessive toothbrushing. Obsessive-compulsive disorder, OCD, manifests through a constellation of symptoms that encompass both obsessive thoughts and compulsive behaviors. These symptoms, often distressing and time-consuming, significantly impact an individual's daily life, relationships, and overall well-being. Obsessive thoughts. Obsessions are intrusive and persistent thoughts that cause significant anxiety or distress. They can take various forms and may include fear of contamination, excessive concerns about dirt, germs, or the fear of becoming contaminated. This may lead to compulsive washing or avoidance behaviors. Accidents or acts of violence, anxiety surrounding the possibility of harm, either to oneself or others, such as fearing an unlocked door leading to intrusion or worrying about causing accidental harm. Fear of committing harm, intrusive thoughts about causing harm to others, either physically or sexually, leading to distress and anxiety. Symmetry and order, a preoccupation with order, symmetry, or specific arrangements, where even minor deviations can cause distress. Other irrational fears, various fears and anxieties that are often irrational and may involve specific numbers, colors, or other seemingly unrelated elements. Compulsive behaviors. Compulsions are repetitive actions or mental rituals performed in response to obsessive thoughts, with the goal of reducing anxiety or preventing a feared event. Common compulsions include excessive washing or bathing, repeated and ritualistic cleaning rituals to alleviate the fear of contamination. Avoidance behaviors, refusal to touch certain objects, shaking hands, or avoiding specific places to prevent perceived harm or contamination. Checking rituals, repeatedly checking locks, stoves, or other appliances to ensure they are secure and to prevent potential harm. Counting and organizing, compulsive counting of objects or arranging items in a specific way to achieve a sense of order and control. Repeating actions, engaging in repetitive actions, such as repeating specific words or prayers, to reduce anxiety associated with obsessive thoughts. Impact on daily life. The obsessions and compulsions in OCD are not merely quirks but have a profound impact on an individual's daily functioning. Time-consuming. The rituals and repetitive behaviors can consume significant amounts of time, sometimes several hours each day. Interference with relationships. OCD can strain personal relationships as the individual may be preoccupied with their obsessions and rituals, leading to misunderstandings and isolation. Work or academic impairment. Performance at work or school may be hindered due to the time and mental energy dedicated to managing OCD symptoms. Physical consequences. Certain compulsive behaviors may result in physical harm, such as chapped hands from excessive washing or other self-inflicted injuries. Awareness of irrationality. Many individuals with OCD are aware that their obsessions and compulsions are irrational. But the distress and anxiety associated with these thoughts often override rational thinking. This awareness can contribute to feelings of frustration and helplessness. Diagnosis. Individuals with OCD may initially seek help from a primary care physician due to the impact of symptoms on their health. Depression is a common comorbidity in OCD, often overshadowing the discussion of embarrassing or challenging to describe symptoms. Primary care doctors typically refer patients to mental health professionals for a comprehensive evaluation. Diagnosis involves assessing obsessive thoughts, compulsive behaviors, psychological distress, consequences in relationships, and daily activities, and potential symptoms of other psychiatric disorders. Insight into one's symptoms varies, with some individuals recognizing their irrationality, while others may exhibit poor or no insight, posing challenges in treatment. The diagnosis of Obsessive-Compulsive Disorder, OCD, involves a comprehensive assessment conducted by mental health professionals. Given the nuanced nature of this disorder, a thorough evaluation is crucial to differentiate OCD from other mental health conditions, and to tailor an appropriate treatment plan. Here is an in-depth exploration of the diagnostic process for OCD. Clinical evaluation. Obsessive thoughts and compulsive behaviors. Mental health clinicians begin by gathering detailed information about the individual's obsessive thoughts and compulsive behaviors. This involves a careful exploration of the nature, frequency, and intensity of these symptoms. Psychological distress. Assessment includes an evaluation of the emotional impact of OCD, considering the level of anxiety, distress, and impairment experienced by the individual. Consequences in relationships. The clinician examines the impact of OCD on personal relationships, as the disorder often influences social interactions and may contribute to misunderstandings or isolation. Consequences at work or school. The extent to which OCD interferes with occupational or academic performance is assessed to gauge the overall impact on daily functioning. Differential diagnosis. Other psychiatric illnesses. The clinician considers and rules out other psychiatric conditions that may share similarities with OCD, such as generalized anxiety disorder, panic disorder, or specific phobias. Depressive symptoms. Depression commonly coexists with OCD, and distinguishing between depressive symptoms and the core features of OCD is crucial for an accurate diagnosis. Tic disorders. Some individuals with OCD may exhibit symptoms of tic disorders, and the clinician assesses whether tics are present or have occurred in the past. Insight assessment. Level of insight. Understanding the individual's awareness of the irrational nature of their obsessive thoughts and compulsive behaviors is essential. Some individuals have good insight, recognizing the irrationality, while others may have poor or no insight, which can impact treatment planning. Medical evaluation. Rule out medical causes, as certain medical conditions can mimic or exacerbate symptoms resembling OCD. A thorough medical evaluation is conducted. This ensures that physical health issues are not contributing to the observed symptoms. Medication review. The clinician considers any medications the individual may be taking, as certain substances can induce symptoms resembling OCD. Collaborative approach. Involvement of primary care physicians. Individuals with suspected OCD may initially seek help from primary care physicians. Collaborative efforts between mental health professionals and primary care doctors enhance the diagnostic process and facilitate appropriate referrals. Structured clinical interviews. Structured tools. The use of structured clinical interviews and standardized assessment tools aids in systematically gathering information about symptoms, severity, and functional impairment. Diagnostic and Statistical Manual of Mental Disorders, DSM-5. The DSM-5, a widely recognized manual for mental health professionals, provides diagnostic criteria for OCD. The clinician evaluates whether the individual's symptoms align with these criteria. Family history and psychiatric history. Genetic predisposition. Considering the genetic basis of OCD, obtaining a detailed family history helps identify potential genetic predispositions. Psychiatric history. Exploring the individual's psychiatric history provides insights into the onset, progression, and nature of OCD symptoms. Expected duration. OCD rarely resolves spontaneously, and symptoms may persist for years without proper intervention. Early detection and treatment significantly mitigate the long-term impact of the disorder. Unfortunately, many individuals endure OCD for 5 to 10 years before seeking psychiatric assistance. Prevention. Obsessive-Compulsive Disorder, OCD, is a chronic mental health condition characterized by persistent, intrusive thoughts, obsessions, and repetitive behaviors or mental acts, compulsions. The expected duration of OCD varies among individuals and is influenced by factors such as the severity of symptoms, the timing of intervention, and the effectiveness of treatment. Here are key considerations regarding the expected duration of OCD. Chronic nature. OCD rarely resolves spontaneously. It tends to be a chronic condition with symptoms persisting over time if left untreated. The chronicity of OCD underscores the importance of early detection and intervention. Varied course. The course of OCD is highly variable. Some individuals may experience periods of exacerbation and remission, where symptoms intensify at certain times and improve at others. Others may contend with a more persistent and uninterrupted course of symptoms. Treatment impact. Timely and effective treatment significantly influences the expected duration of OCD. Early intervention, which may include psychotherapy, medication, or a combination of both, can mitigate the severity of symptoms and improve long-term outcomes. Delayed treatment seeking. It is not uncommon for individuals with OCD to delay seeking professional help. The delay in treatment seeking can prolong the duration of the disorder, allowing symptoms to become entrenched and more challenging to manage. Individual variability. Each person's experience with OCD is unique. Factors such as the specific obsessions and compulsions, level of insight, and the presence of co-occurring conditions contribute to the variability in how individuals navigate the course of their disorder. Co-occurring conditions. The presence of co-occurring conditions, such as depression or anxiety disorders, can impact the overall duration and complexity of OCD. Addressing these concurrent conditions is crucial for a comprehensive treatment approach. Impact on functioning. The extent to which OCD interferes with daily functioning, relationships, and occupational or academic pursuits influences the expected duration. Severe impairment may necessitate more intensive and prolonged treatment. Persistent symptoms. For some individuals, OCD may persist for several years before they seek psychiatric assistance. The duration of symptoms before intervention can contribute to the chronicity of the disorder. Ongoing management. Even with effective treatment, ongoing management and maintenance strategies are often necessary to prevent relapse. Regular follow-up with mental health professionals and adherence to treatment plans contribute to sustaining positive outcomes. Quality of life. The ultimate goal of OCD treatment is to enhance the individual's quality of life by minimizing the impact of symptoms. Improvements in functioning, relationships, and overall well-being contribute to a more favorable long-term prognosis. Treatment. The most effective approach to treating OCD involves a combination of psychotherapy and medications. Addressing any concurrent conditions, such as medical problems or depression, is also integral to comprehensive treatment. Psychotherapy techniques, including exposure and response prevention, ERP, and cognitive behavior therapy, CBT, have demonstrated efficacy in managing OCD symptoms. ERP exposes individuals to situations triggering obsessive thoughts while preventing the usual compulsive response. Habit reversal, thought stopping, and saturation are additional techniques employed in psychotherapeutic interventions. Obsessive-Compulsive Disorder, OCD, is a challenging mental health condition. But various effective treatment approaches can significantly improve the quality of life for individuals affected. Treatment for OCD typically involves a combination of psychotherapy, medications, and, in severe cases, neurostimulation techniques. Here is a comprehensive overview of these treatment modalities. Psychotherapy. Cognitive behavioral therapy, CBT, particularly with a focus on exposure and response prevention, ERP, is considered the gold standard for treating OCD. ERP involves exposing individuals to situations that trigger obsessive thoughts while preventing the corresponding compulsive response. Over time, this helps individuals build tolerance to anxiety and reduce the need for compulsive behaviors. Habit reversal. This technique encourages individuals to replace compulsive behaviors with alternative, more adaptive responses, such as deep breathing or muscle relaxation. Thought stopping. In thought stopping, individuals learn to interrupt obsessive thoughts by using a distraction, such as saying the word stop and engaging in a competing activity. Medications. Selective serotonin reuptake inhibitors, SSRIs, medications, particularly SSRIs, are commonly prescribed for OCD. Fluvoxamine, fluoxetine, sertraline, paroxetine, citalopram. and escitalopram are examples of SSRIs that have demonstrated effectiveness in managing OCD symptoms. Tricyclic antidepressants. Clomipramine, a tricyclic antidepressant, is another option and is sometimes used when SSRIs prove insufficient. Clomipramine, while effective, may have side effects that some individuals find challenging. Antipsychotic medications. In cases where there is poor insight or a lack of response to SSRIs, an antipsychotic medication, like risperidone or aripiprazole, may be added to augment treatment. Neurostimulation. Deep brain stimulation, DBS. DBS is a neurostimulation technique reserved for severe, treatment-resistant cases of OCD. In DBS, electrodes are surgically implanted in specific brain regions thought to be involved in OCD symptoms. This intervention is considered when other treatments have not yielded satisfactory results. Psychosocial support. Supportive therapy. Individual or group therapy provides a supportive environment for individuals with OCD to share experiences, discuss challenges, and receive encouragement. Family therapy. Given the impact of OCD on family dynamics, involving family members in therapy can be beneficial. Family therapy helps improve understanding and support while addressing the challenges that OCD poses to familial relationships. Education and awareness. Psychoeducation. Educating individuals with OCD about the nature of the disorder, the role of treatment, and strategies for managing symptoms is integral to the therapeutic process. Knowledge empowers individuals to actively participate in their treatment. Lifestyle modifications. Healthy living. Encouraging a healthy lifestyle, including regular exercise, sufficient sleep, and a balanced diet, can contribute to overall well-being and support the effectiveness of other treatment modalities. Regular follow-up. Continued monitoring. Regular follow-up appointments with mental health professionals are crucial to monitor progress, adjust treatment plans if necessary, and address any emerging challenges. Combination of approaches. Tailored treatment plans. Given the individualized nature of OCD, treatment plans are often tailored to each person's specific symptoms, preferences, and response to interventions. A combination of psychotherapy and medication is frequently the most effective approach. Relapse prevention. Maintenance strategies. Once symptoms improve, individuals may benefit from ongoing maintenance strategies to prevent relapse. This may include periodic booster sessions of therapy or adjustments to medication. For refractory cases, neurostimulation techniques such as deep brain stimulation may be considered. This involves implanting ultra-thin electrodes in specific brain regions associated with OCD symptoms. However, this intervention is reserved for cases unresponsive to psychotherapy and multiple trials of antidepressant treatments. Your health matters. Quali.health